observes the client's gait. Ma'am, lakad lang po kayo ng 3 hakbang. Okay? Assesses for the risk of falling. Okay. So, as we can see that the patients have an erect posture and there is no risk of falling and the gait is steady and it is patients able to maintain her balance. In assessing temporomandibular joint, inspects and palpates the TMJ. Test range of motion. Ma'am, bukas lang yung bibig. Okay? May masakit po ba? Pakigalaw lang yung panga nyo. Okay? Okay. So, as we can see, there is no deformities, there is no swelling or any bony overgrowth, and the patient does not have any pain. At the same time, there is no limited movement, able to open the mouth with ease. Let's proceed to sternoclavicular joint. Inspects for location in midline, color, swelling, and masses. Palpates for tenderness or pain. So, ma'am, labanan nyo lumingon po kayo dito sa kaliwa, labanan niyo yung kamay ko. Okay? So, as we can see, there is no discoloration, there is no swelling or edema, and the patient does not experience any tenderness. Okay? And the muscle strength of my patient, it has 100% of the normal strength, able to resist my hand. So it has a full strength. For cervical, thoracic, and lumbar spine, observes the cervical, thoracic, and lumbar curves from the side, then from behind. Palpates the spinous processes and the paravertebral muscles on both sides of the spine for tenderness or pain. Test ROM of the cervical spine. Test ROM of the thoracic and lumbar spine. Okay, flex. Taas. Babahan for extend. Tapos, yung tenga nyo, i-touch nyo dito sa may shoulder. Okay? Sa kabila. Okay. So, paki-bend lang po. Okay? Bend na. Bend. Okay. Tayo. Hyperextend. Okay. So, based on our observation, the patients have a normal curvature on the cervical, thoracic, and lumbar area. And there is no, the muscle tone is well developed, it is smooth, it's firm. May masakit po ba? The patient does not experience any pain, so there is no stiffness. Then at the same time, for ROM, the patient is able to do the range of motion with ease. Assess the shoulders and arms by inspecting and palpates shoulders and arm. Test ROM. Okay. Ma'am, hawakan nyo. Labanan nyo, tanggalin yung kamay ko sa shoulder nyo. Strug nyo lang nyo. Tanggalin nyo. Okay. So, as we can see, no, the patients have a symmetrical shoulder. The cervical and scapula is also symmetrical and even. There is no presence of deformities. Okay? And as I palpate it, may masakit po ba? There is no tenderness or even no jewels. Okay? So when I test the muscle strength, no, the trapezius is well developed. It has a fully 100 100% of the normal strength. So that means patients have good trapezius muscle strength. At pakitaas mo yung dalawang kamay habang ibababa, labanan niyo ko, ha? Okay. Okay. Now proceed to the elbows. Inspect for size, shape, deformities, redness, or swelling. Test ROM. Extend ko siya habang labanan niyo po, ha? Labanan niyo. Okay? Okay. So, naka-flex po kayo, labanan din niyo. Okay? So, based on my observation, there is no deformities, there is no redness on the elbow, and may masakit po ba? Okay. So, there is no swelling, and patients does not experience pain. A while ago, as the patients extend, I try to bend. Labanan niyo po. Okay? Okay. Huwag niyong i-flex, ha? This is to test the bicep. Now, for the tricep, labanan mo. Okay? This is to test the tricep muscle strength. So, the deltoid, a while ago, I done that. And the bicep and tricep, it has a fully strength. Okay? So that means the patients have a normal muscle tone and have a full muscle strength. For the wrist, inspect wrist size. Shape, symmetry, color, and swelling. Palpates for tenderness, nodules, and test for ROM. So, based on the size, I gathered 6 inches, so it is symmetrical, and there is no discoloration or swelling. The shape is normal. That means there is no deformities or bony prominences or overgrowth. Okay? So, I asked Ma'am Dalipe if there's tenderness. There is no tenderness and there is nodules. Okay? Then let us test for the muscle strength, wrist and finger. Okay? So, Ma'am, spread niyo yung kamay. Okay? I try to adduct. Wag niyong, labanan lang niyo. Okay? So, now, for the wrist, there is no deformities and it has a full strength, including the finger muscles. So, that means able to resist my force, when able to resist as I attempt to push the finger. Okay, and try to put the fingers together. That means the patients have a normal strength. So for the hands and fingers, inspect size, shape, symmetry, and color. Palpate the fingers from distal and proximally. Test ROM. Okay. Ma'am, hawakan niyo yung aking kamay. Okay? Okay. So, as we can see, the fingers of my client, it is aligned. There is no discoloration. There is no deformities or growth on the joints. Then, at the same time, patients have, ma'am, masakit ba? May masakit? There is no tenderness. As you can see, I ask the patients I check the grip strength, so the patient's able to grasp my finger with a full strength. For hips, inspect symmetry and shape of hips. So the patients have symmetrical hips. There is no abnormalities seen. Then it is even. Then as I palpate, there is no tenderness. May masakit po ba? Okay, and the patients have a little bit large, okay, but there is no deformities and there is no swelling, no, and there is no tenderness. Now we will proceed to check the muscle strength. So I will instruct the patients to lie down. Hip muscle, so I will instruct the patients to raise the leg. Okay? So ma'am, pakitaas ang paa habang ibababa ko, ipupush ko, ha? Labanan nyo yung aking kamay. Okay? Doon din sa kabila, taas ang paa. Okay. So this is to test the hip muscle. Now, naka-spread lang po. Okay? Hawakan ko dito. Tapos, try mo i-open. Okay? Okay. This is hip abduction. Okay. Tapos, i-close mo yung paa mo. Try mo i-close yung paa. Okay? This is hip adduction. As you can see, the patients have a full muscle strength. With regards to the hip muscles, hip abduction and hip abduction. So, it has 100% of the normal strength. Knees. With the client supine or sitting with knees dangling, inspects for size, shape, symmetry, swelling, deformities, and alignment. Have symmetrical, there is no deformities. Ma'am, may masakit ba? So, there is no pain. There is also no discoloration when I inspect the knee. Okay. So, it should be symmetrical. So, palpates for tenderness, warmth, consistency, and no juice. So, there is no warmth. There is no nodules, there is no swelling, and the size is symmetrical and it is even. Now, I'm going to test for the muscle strength of the hamstring. So, I will instruct the patients to bend the knee, okay, while I try to extend it. Ma'am, labanan nyo. Okay? That is to check for the hamstring. Now, for quadriceps, patients try to flex, I try to extend. Okay? So, flex nyo siya. Labanan nyo, ha? Okay? So, that is to test for the quadriceps. So, patients have a muscle, 100% normal muscle strength. Ankles and feet. With the client sitting or standing and walking, inspects position, alignment, shape, and the skin. Palpates ankles and feet for tenderness, heat, and swelling. Test for ROM.
Bugas ako ng kamay. Okay? So, the fingers is symmetrical. There is no deformities. And the toes is not pointing upward or downward. So, there is no pes valgus or pes, what do you call this? It is a pes varus. So, it's normal. So, since I asked the patient to lie down instead of walking, I would like to inspect for the dorsiflexion. Ma'am, i-flex nyo siya habang ibababa ko siya. Okay? Plantar flexion, ibaba ang kamay, tapos paa pala. Sige. Okay? So, with regards to the muscle strength of the ankle and feet, it is normal. It has a full strength.